This is a video that will instruct you on how to drop your semaglutide or tirzepatide. First of all, you want to make sure that you wash your hands. This is imperative. Whoever is going to be giving you your shot, or if you're going to be giving yourself a shot, you'll want to make sure that you are washing your hands. Then you'll want to get an alcohol prep and make sure that you clean the site. So what are the sites for semaglutide? Well, you can use and the back of the arm, it's nice and squishy. You can use the side of the abdomen, lateral or to the side of the belly button, on one side or the other, or the inner thigh. On the inside of the thigh, you can squish just a little bit of meat and then just inject. So for this video, I'm not going to obviously inject myself, but I will show you how to drop the medication, and then I will use this lovely squishy, which is actually an eyeball, and pretend to inject it so that way you can see how this is all going to play out. So after you wash your hands, you're gonna get an alcohol prep, open it up, and today let's say that you're injecting someone in the arm. So you just clean the area. Circle, 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 circle. That's a great way to make sure that it's clean. You want to get a little bit of friction there. So then you clean until the alcohol prep is clean. If you see that the alcohol prep is dirty, continue to clean. All right. You will have a insulin syringe that looks similar to this. And on your instructions, it will tell you up to what unit on the insulin syringe to draw the medication up to. So you remove the bottom cap, and then you will remove the top cap, which then reveals the needle. Then what you're going to want to do is actually get some air into the syringe. So let's say that you are starting off at a dose of 10 units. So you're going to pull your plunger back to the number 10. Say you need to pull the plunger back to 20 units, then that's what that would look like. Then what you do, you have your insulin syringe, needle. You also want to use a fresh alcohol prep and clean the top of the vial. If the vial, and when you first get the vial, it will have like a little cap. You just pop that cap off and then you'll be able to do what I just did in cleaning it. So here you insert the needle straight down and you push that air in. Then with the needle in the vial, you flip it over and then you pull back on the syringe. This just allows for the medication to move more freely. You will see that there's far more in the syringe than what we actually need. Let's say that you need 10 units. So then what we will do is we will push the syringe, the plunger, back up to 10. And then we take it out. Here you see we are at 10 units. And then now I'm going to, for purposes here, I'm going to put the medication back in the vial. But for purposes here, I'm going to pretend like I'm injecting an arm, let's say. So you hold the syringe and with the needle in, you're going to inject, and then you're going to go straight in and you're going to pinch the skin like that. And the sites that I showed earlier, pinch the skin and inject. Obviously not an eyeball, but the areas are the back of the arm. See how much I'm pinching there? Just a little bit. You want it in the fatty area, in the skin, not in the muscle. The inner thigh, if you grab on your inner thigh, you can get a good pinch there. And if you have any belly fat, you can then go on one side or the other of the belly button. Now, what you'll want to do is rotate your sites. So once a week is when you get your injection. Then the next week, what you'll want to do is change sites. You do not want to inject the medication in the same site. So again, when you get your medication, you wash your hands, you get all your supplies ready, you take the cap off, you pull back, get a little bit of air in, typically around the amount that your dose is going to be. You have already cleaned the cap, and you inject, push the air in, flip the vial upside down, pull out. Here you have medication. For our purposes, I'm gonna put it right back in, but you will not. Whatever unit or medication amount that you were supposed to use, you pull that out. Then you find an area, arm, belly, inner thigh, pinch just the fat, go in at a 90-degree angle, push the plunger in, release, you're done. Then you put your sharp, there's a needle, in the sharps box. If you have any questions about the actual process of injecting, please let me know. You can always contact me through the patient portal, and I will be glad to get back in touch with you. And it should not be that painful. It actually shouldn't be painful really at all. And hope this helped. Thanks.